Few minutes to introduce myself. I am live on all of the platforms now. So, welcome to Wellness Wednesday with Dr. Latoya Wells. I am a family nurse practitioner, certified, board certified family nurse practitioner who holds a doctorate degree in nursing practice. I am the owner of Wells Legacy Health and Wellness, and as a way to give back to my community and focus on what I enjoy doing, I have set up Wellness Wednesday with Dr. Wells. So I'm here each and every Wednesday, just about, except for when we're on vacation and whatever holidays. And in that case, I will plan to provide you guys with a recorded message. This month, we have been talking about diabetes in men's health. Each month, there is a disease process that is highlighted all around nationwide. And so this month, two of the ones that stood out to me was diabetes and men's health. So in the beginning of the month, for our first Wellness Wednesday, we talked about diabetes, just did a general overview what diabetes is, who's at risk for diabetes, the signs and symptoms of diabetes, and so forth. The second week, we had some more information in regards to diabetes, and we had a friend and a colleague of mine, Camille Bell, um, on, and she talked with us about diabetes and how it relates to men's health. Last week, I came on and we talked about diet and some other complications of diabetes and did a little more deep dive into that. Tonight, we're going to focus on just some tips and things that you can do to manage your diabetes. And there's many individuals who are living with diabetes, and so just kind of talking about some of the recommendations on things that you can do in terms of diet, exercise, things of that nature that you can do to manage your diabetes. And the biggest thing is your diet, right? What you eat, what you put on your plate, what you put in your body can have a major impact on your diabetes and how well that is managed. So we're going to talk a little bit about that, but I want to give 6 tips and we'll do a little deep dive into each one of those as we discuss each one. But as you may remember, when we discuss some of the things that you can do to help prevent diabetes or manage your diabetes was get moving, exercise. And it's recommended that you have at least 30 minutes of moderate intensity cardiovascular disease 5 days a week. So getting your body moving, getting up, get moving, getting active helps, one, burn calories. It helps to decrease stress, and overall is good for your body, right? But as I mentioned, what I'm giving you are just tips and some recommendations. If you have a primary care provider, which I hope everybody who's watching does, um, you're seeing your primary care provider on a routine basis. And if you have diabetes, then most likely you're seeing them more frequently. But before you start any new exercise regimen or any new supplements or anything like that, that may be mentioned here on Wellness Wednesdays, we would recommend that you reach out to your healthcare provider, your primary care provider. And if you don't have a primary care provider, we are now accepting new patients. So you can always reach out to us on our website, our phone number, social media. I'll kind of put that plug in at the end. If you have your primary care provider, you're going to be getting your checkups. And that's the next point, getting your annual checkup, your annual physical exam. And again, if you have a condition such as diabetes, chances are you will be seeing your primary care provider or your healthcare provider more frequently. So that's the second tip. The third tip is know your numbers. Know your hemoglobin A1C. The hemoglobin A1C, and if you can remember our message, our talk, our live with Camille Bell, and earlier in the month when we discussed what the hemoglobin A1C is. The hemoglobin A1C is a 90-day look back average of what your blood sugars or your glucose or sugars, as some people call them, are over the last 90 days. So it takes those numbers for 90 days and it gives you an average. And based on that average, it will give you a number. When we discussed A1Cs, knowing your numbers, it's important for you to know what your A1C is, whether you're pre-diabetic, whether you are or you're diabetic. And some people will say, oh, well, I was told that I have a touch of diabetes. There's no touch of diabetes. It's either you're diabetic or you're not. And I just want to pull the ranges up again. So make sure I'm giving you the right thing. So the range for A1C, we want to see a hemoglobin A1C of less than 5.7. If it's greater than 5.7 to 6.4, you are considered to be pre-diabetic. So anything less than 5.7 is normal, but 5.7 to 6.4 is considered pre-diabetes, meaning that you are at a higher risk for developing diabetes. And some individuals may have their understanding that when you're being told that you're pre-diabetic, that you have a touch of diabetes or a little sugar or a little diabetes. That just means that you're at a higher risk for developing diabetes, and we need to intervene now, such as getting you active, losing some weight, monitoring your diet, changing your diet, and doing things that we can do to get that number to either stay where it's at or continue to decrease and not increase. So anything greater than 6.4 is considered a diagnosis of diabetes. What are the numbers do we need to be concerned about or to consider to watch? Your cholesterol. We need to make sure you know what your cholesterol, your total cholesterol, your lipids is what we call them. The LDL, the HDL. So knowing what your cholesterol numbers are. Another thing you want to be mindful of is, if you are diabetic, is your kidney functioning. Many individuals who are diabetic may also have something called chronic kidney disease. And that's because the damage of the diabetes has impacted the kidneys. And so you want to make sure you know your A1C, your cholesterol numbers, and your kidney numbers, your kidney functioning. Also, your high blood pressure, well, not high, hopefully it's not high, but your blood pressure is another number that you want to be aware of and be mindful of. As we've discussed in the past, diabetes is a progressive disorder and it causes damage to many organ systems. As we talked about last week, I showed you guys a graphic of the different body systems that is impacted by diabetes. And so knowing what your blood pressure is can help determine if there's increased damage, increased risk of damage to your kidneys and your heart and things of those nature. Learn ways to manage your stress. Whenever we are stressed, our cortisol levels increase. And cortisol is a hormone that is increased whenever an individual is experiencing high levels of stress. And that can increase your insulin levels, the amount of insulin within your body. And it can also increase your weight because you're holding on to this hormone that can increase your weight. So we've noticed that if we work with individuals, whether they're diabetic, pre-diabetic, what have you, if we work with individuals to, one, decrease their stress, find ways that will help you decrease stress. For me, working out is a stress reliever that has a twofold outcome for me, because it helps me to maintain weight and as well as decrease stress. So that way, in turn, my cortisol levels are being decreased as well. The next thing is make and eat healthy food. So tonight we're going to do a little bit more deep dive into foods that we recommend for diabetics. And what I say, I just had a consult with a client this week, and we talked about diet and exercise and what they can eat and what they can't eat. And so I never tell someone that you can't eat this or you can't eat that. It's all in moderation. And then the last tip, and then we're going to do a little bit more deep dive into diet and exercise or diet, is to take your medication as prescribed. If you've been prescribed medication for your diabetes, for any other condition, for your high blood pressure, what have you, take it even if you are feeling better. You've been given the medication for a reason. Typically, we will try lifestyle modifications, which would include no medication if we can. However, if it gets to a point where the A1C is high, it's a little uncontrolled, the blood sugars are not being controlled, the blood pressure is elevated, we're noticing changes in the kidneys, we need to get you on some medications that are going to help. Okay. And so taking the medication as prescribed is very important. There are many individuals who like to go the healthy route, the natural, well, not healthy, but natural route when it comes to not taking medication. And sometimes we can do that. However, there are times when we won't necessarily be able to go that route any longer. We can give it a try and see how it works. But if it gets to a point where your health and your life is at danger, then we need to get you on medication. So when it comes to foods and things of that nature that we want to, it says avoid, but I wouldn't necessarily say avoid, but we want to make sure that we're monitoring the amount and the quantities of certain things that you're eating. Now, are there foods that we should stay away from? Like if you're an individual who likes rice or pastas and that's your downfall and you're eating a large amount of pasta, then I would say we may want to stay away from the pastas and the starches and the rice for some time until we can get the blood sugars under control, till we can get the A1C under control, and then we might be able to slowly reintroduce that. So processed meats are one thing that we want to have our individuals stay away from or modify the quantities in which they're eating. These foods come with increased sodium, increased unhealthy fats, which can cause the blood pressure as well as the cholesterol levels to increase. And so if you're an individual who likes the beef jerky, which I love me some beef jerky, I need to really look at that. And I've done a really good job at moderating the amount of those things that I'm eating. So you can replace those processed meats with leaner, more natural protein choices. So we want you to get protein, but we want it to be natural or more healthy protein choices, such as chicken, turkey, tuna, or hard-boiled eggs. Full fat dairy products. Again, these products can cause an issue with cholesterol levels. And so we want to make sure that if you are someone that loves milk or dairy product and cheeses and things of that nature, that you're eating those things in moderation, or you're looking for a healthier alternative. The nut milks, the almond milk, the oat milk seems to be better and less fat, or decreased fat milk, low fat milk, things of that nature. So those types of dairy products. Soy milk is another one. So again, the processed snacks and processed baked goods, so the cookies and the chips and the cakes and things of that nature, not that you can't have them, but in moderation. But like if you come to me and your cholesterol levels are high and through the roof, then we're going to have a conversation about, okay, we need to replace this for this. So let's look at giving up the not so healthy options with a more healthier option when it comes to the baked snacks, the packaged snacks, or baked goods. I just had a pack of Oreo cookies. Now, could I have chosen could I have chosen a healthier option? Sure, I could have. But I fell into a trap that many individuals fall into. And there was an individual that I spoke to recently. We were talking about potentially, the um, option of packing their food ahead of time, meal prepping. And they fall into something that I'm guilty of it myself. I've been busy. I had a busy day. I did have 2 meals today, but I got hungry and I grabbed the first thing that I saw when I went into my pantry, and that was a bag of chips and some Oreos. Now, I don't have diabetes, however, and I don't have a strong family history of diabetes. However, I do have a family history of high cholesterol and high hypertension, high blood pressure. And so I have to monitor those things, but it's all in moderation. It's not like I sit and eat a bag of chips every day, 3 or 4 times a day. But again, it's all in moderation. And meal prepping, had I planned my meals ahead of time or my snacks ahead of time, then I would have had something available, a healthier option available. So something that I was going to speak to later in the session was some recommendations, and one of those is meal prepping, planning ahead when it comes to your meals and what you're going to eat, and you're less likely to, at that point, choose something unhealthy because you've already prepared a more healthier option. The white carbohydrates, the white grains, white rice, the potatoes, pastas can all increase cholesterol, as well as those things turn into sugar, and it's broken down. Well, it's broken down into sugar, and so it then increases the blood sugar and the hemoglobin A1C. So look for brown rices and all other alternative brown rice, the quinoa, the whole grain pastas, and whole grain bread. I'm a bread person. I love my bagels. I love my potatoes. I love chips and things of that nature. And so if you're someone who likes those options and that's something that you eat on a regular basis, look at something different. One thing that my mother-in-law put me on to was cauliflower mashed potatoes. I would have never in life thought that cauliflower mashed potatoes would taste good and have the consistency of regular mashed potatoes, and they actually are pretty good. And you can flavor it the way that you want, and you can make it the consistency that you'd like. So there's always an option, and there's so many different groups on Facebook and on social media. Pinterest has an amazing list of alternatives when it comes to food choices. So a lot of resources out there. Sweetened breakfast cereal. If you're one that likes cereal in the morning, make sure you're not eating something that has a lot of sugar in there. Many times we see cereal boxes and foods, and it's presented in a way in which is healthy when actually it's not. So take time to read your labels, take time to look at the grams of sugar that's in a serving. Because if you grab that box of Cheerios and you think, oh, Cheerios is healthy, it says it's heart healthy because it's a whole grain. But we have to look at what the portion size is, one, right? Because you can't go pour a whole bowl of Cheerios, a huge bowl of Cheerios, and to eat more than the recommended serving size and think that that's going to be healthy, especially if you have diabetes. And Cheerios is a healthy food. It is heart healthy, but it does have that honey in there, and that could cause some issue. In other food, there are other cereals as well. So instead of that, the sweetened cereals, you want to get things like oatmeal and granola or packaged breakfast cereals that contain little to no sugar. So you can still eat your cereal in the morning if that's what you enjoy. Just look for the healthier options. So dried fruits, if it's just dehydrated fruit and it's not preserved with anything, then that can tend to be okay. We still have to monitor how much fruit an individual with diabetes is taking. Not that you can't have it, just in moderation. But when it comes to the dried fruit, they can have an extra sugar added onto it just in order to preserve it. So just be mindful of that. Be careful with what you're putting in your body. And fresh is better. So instead of the dried fruits or the processed fruits, look at some healthier fruit, fresh fruit that you can have on hand. French fries, we already talked about that. French fries, one, they are carbohydrates, they're the starches, and then they're fried. Some other alternatives to frying them in oil and the fatty oils is to put them in the air fryer and just lightly season them. But then we got to be careful with the sodium that we're adding onto it. So again, all things in moderation. High fat cuts of meat. So when we're looking at meats, make sure that you're getting meats that are low in fat and looking at the cuts of meat that don't necessarily have the increased fat. Foods that have trans or high amounts of saturated fat. We talked about that earlier. Just be mindful of the different foods that you're eating, because again, it will sometimes say that they're low fat, but we have to be mindful what we're putting. And then we just have to do the research to actually look at the foods that you're eating. So overall, again, I err on the side of caution when it comes to talking with individuals about what they can and can't have to eat. And I don't like to say you can't eat this or you can't have that. It's all in moderation, right? So whatever you're doing, make sure that you are being smart about it, choosing the healthier options, and all things in moderation. We talked about previously the My Plate Planner. That's a really good visual of what the American Diabetic Association recommends in terms of food and the plate. So it's an 8-inch round plate, and half of the plate is going to be your veggies. A quarter of the plate is the lean protein, and then a quarter of the plate is the starches. And the lean protein should fit in the palm of your hand, and that's the serving size that they recommend. So I would encourage you to look up the My Plate Planner. Go to Google the American Diabetic Association. Google different food planning, meal prepping ideas for low fat, low sodium, low sugar foods. And some people say, it doesn't have anything good in there. You can make it what you want it to be. We just want you to be healthy. Make sure you're getting your blood sugars checked. Make sure you're following up with the recommendations of your healthcare provider. Make sure you're getting exercise, at least 30 days of moderate intensity exercise, 5 days a week at least. Make sure you know what your numbers are. If you have questions, ask the questions. Follow up when you're supposed to. We're getting ready for Thanksgiving, and I know there's many that are baking the pies, they're baking the cakes. The family's going to have the stuffing, or we call it dressing. I don't call it stuffing. I eat dressing. I love it. But there are many who call it stuffing. And there's going to be the ham and the turkey and the ribs and whatever it is that you and your family prepare and consume for Thanksgiving. As we prepare for Thanksgiving tomorrow, be mindful of what it is that you are putting on your plate. If you have started working out and you started working on monitoring your health and making healthier choices, plan ahead for how you're going to handle your meal for tomorrow. Are you going to get in the extra workout so that you can indulge a little bit more? That's going to be for you to decide. Ultimately, we just want you to be healthy. We want you to have the knowledge and information that you need to be able to advocate for yourself and make healthy lifestyle choices. Again, it is our goal and our model that we empower our patients, our family, and our friends to be able to advocate for themselves, to be able to create a legacy of good health. And you can't do that if you don't have the knowledge and the information. But I can give you all the knowledge and information every week, every Wednesday, every day. We can talk and talk and talk, and I can get you whatever resources that I have. However, it takes you as an individual, you as a patient, you as the mother, you as the father, the child, what have you, to put the things into action that you need to do to make sure that you're making healthy choices. Next month, we will be speaking on a different topic, and I will let you know what that is on social media, so you'll find out about that. If you have any questions, if there's something that you need clarification about, reach out to us. Again, we are open to new patients. At the moment, we are still only cash-based pay. However, we are in the process of getting credentialed with several insurance companies, and we will announce when that happens. We're excited to be here to serve the community. We're located at 542 Osceola Street, Altamont Springs, Florida, Suite 106. Our website is wellslegacyhealth.com. We can be reached at 321-306-6755. And I wanted to bring up information. I meant to bring it up last week on my colleague, Camille Bell. I want to give you her contact information. I had someone reach out to me, and she's a specialist. I consider her to be an expert on diabetes. And so and I'm the type of provider, if it's something that I can't provide you or I don't feel like I'm an expert in, I have colleagues, I have friends who are expert in certain things, and I want to make sure that I get you to the right person. And so I meant to do this while we were on our call, and I forgot to do that. So I wanted to highlight her business. It's Pinnacle Family Diabetes Medical Center. And the phone number is 407-759-6254. And so look her up, look up her website and check her out. She is located in Claremont, and she provides an amazing service to her patients. And so I just wanted to be able to highlight that. Anytime I have someone on and they have their business, I want to be able to share that information. And so after our broadcast a couple weeks ago, I said, oh man, I forgot to give your business information or have her share that information with you all. But look her up. There's so many amazing providers. But if you don't have a primary care provider, if you have an urgent care issue, if you need to see me, you can't be seen by your primary care provider, reach out to us. We offer telehealth, so we can see you via, virtual visit, what have you. We're here to serve the community. Again, I also offer CPR classes. So if you know someone that needs CPR, we are branching out into other services. We are now providing medical weight loss. So if you have questions, need assistance, we are here for you all. So please, please, please take care of yourselves. Happy Thanksgiving. And we'll keep you updated on the additional services that we will be providing here in the future. Again, stay safe, be well. This is Dr. Latoya Wells, Wells Legacy Health and Wellness. Happy Thanksgiving. Take care.